as depressive cases are increasing day by day, particularly in corona situation, I want to educate people regarding depressive illness. What is depression? In depression, there must be 5 symptoms among 9 main symptoms for at least 2 weeks duration continuously. Out of these, one must be either depressed mode or lack of pleasure in life. The other symptoms are either decreased sleep or increased sleep, decreased appetite or increased appetite, loss of weight more than 5% of body weight in 1 month duration, fatigue, psychomotor retardation or agitation, decreased concentration, and feelings of worthlessness or guilt, suicidal ideation or attempts. So these are usually seen in depression. So in summary, depression affects every facet of person's life, personal, interpersonal, social, professional, all areas are affected. On the whole quality of life is affected. Then how normal sadness differs from depression? Normal sadness such as grief or bereavement may follow upon an important loss or complication that is proportional to in regard to duration and severity, proportional to the severity of precipitant. By contrast, in depression, these triggers may not be there in many cases, even though they follow upon a trigger that is out of proportional to the severity of the precipitant. Does every person with depression need treatment? Yes, they require treatment with some or other form of treatment modality. What are the treatment options available? Drug therapy, in which many antidepressants are available, particularly newer antidepressants are doing wonders. They bring out changes in brain and hormonal system is affected in a more positive way to bring out positive changes in person's mood. Second one, psychotherapy. In this, patients are taught in new ways of thinking, positive ways of thinking and behaving to replace their negative attitudes and behaviors. It is done in the form of cognitive behavior therapy and other treatment modalities like interpersonal psychotherapy, in which strained relations are taken care and we focus on coping skills in interpersonal relations. Family therapy. In families, sometimes there may be relational issues or expressed emotions. We give family counseling to all family members to set them right. And group therapy. Group of people with depression are taught various ways of coping skills, psychoeducation and counseling. Other treatment options like electroconvulsive therapy, otherwise called current therapy, is indicated in severe depression not responding to drug therapy and in severe depression having suicidal tendency or suicidal attempts. Phototherapy, called as light therapy, it is indicated in case of depression with seasonal pattern. Brain hormones linked to mood and sleep, improving them ultimately. What can you do if you know you are depressed? Coping with depression is very important. Understand your feelings, share with somebody, stay connected to your family members or loved ones, ventilate your feelings, mingle with people, try to participate along with family members or friends in various social activities so that it can boost up your mood and increase your self-confidence. And apart from treatment, please remember that you must put maximum efforts from your side to make your mood better and better. Lifestyle management is equally important. Diet, which contains omega-3 fatty acids, good nutrition, nutritious value must be taken. Exposed to sun every day for some time so that you will get vitamin D. Avoid alcohol, nicotine and other drugs or sleeping tablets. Do exercise every day. Exercise and games will increase opioids in our brain so that it will increase quality of mood, thinking and enjoy your hobbies, which may include listening to music, spending in nature, traveling, shopping, spending with your friends, and so many. You can try new hobbies like joining in a club, meeting new friends, playing with pet animals, gardening, learning new music, new musical instrument. Apart from these, take some time to relax yourself. You can do yoga, you can do meditation. And equally important is diary writing. If you write diary, you can ventilate your feelings and you can look into yourself so that it will increase insight into your problem. Diary also helpful to a therapist to know about you day-to-day basis. Most important is don't forget to meet your doctor at regular intervals and share with him everything so that he will be given more opportunity to treat you at his best. Can depression affect anybody? Yes, it can affect anybody at any time. What are the risk factors for depression? Adverse childhood experiences like strained relations in the family since childhood, death of parents, particularly mother, during childhood. In family factors, death of spouse or other loved ones, and loss of job, unemployment, and financial problems. In genetic factors, first degree family member if affected with depression, and temperamental issues like personality traits, for example, borderline personality traits. So these are all major risk factors. All these are all risk factors. In summary, temperamental or personality traits, environmental factors, family factors, and genetic factors are all risk factors for depression. How can you help someone with depression? Understand and accept them. Practice assertive communication. Share their feelings. Show a lot of empathy. Don't judge their feelings. Boost up with your words like, yes, I am for you. Kindly share your thoughts. I can understand them. Don't hesitate to share. I am always for you. Like this. So encourage them. Take them for a walk, for an exercise, for games. Whatever they like, you observe them and practice. Be associated with them. Try to observe their feelings and behave accordingly. Don't give up in between because depression takes sometimes weeks or months to recover. Patients may sometimes reject in between. They may reject all your efforts. Sometimes they shout on you out of frustration, but don't give up. Be patient enough and ask softly with kind words whether they have any feelings of suicide. Unless we ask empathically with a lot of concern and affection, they won't share. Always remember that patience cannot be compared with somebody, and don't pass any negative comments. Don't show your negative expressed emotions, and all the family members must be sensitized regarding the depression and its various presentations, and we have to educate them accordingly to the possible extent. All of them must understand so that they can become cooperative to the patient. They can understand, they can accept, and most important, again, try to pass on your observation to the psychiatrist as a third person so that you can understand, because patients may not share their feelings with psychiatrists sometimes, so that you can help in treatment strategy. So with our lot of patience, we can definitely help a lot